Thank you very much. Let's dig right in, Chris. Why don't you begin by telling us a little bit about Calm and Calm Health?
Sure. So Calm, probably most of the people in this room, I'm guessing, know Calm. Benefits folks? Yeah. So 1 out of 2 people in America know Calm. There's Calm, which started off 10 years ago, 12 years ago with meditation, and essentially the pandemic hit and we got into sleep stories, which now becomes the rite of passage for any Hollywood actor who wants to get their name even more famous than it already is to do one of our sleep stories. So the brand resonates. And they asked me to come in about 4 years ago because they wanted to get further into the mental health world because so many business leaders essentially were receiving Calm for their employees, but it wasn't far enough up the mental health continuum to be able to really make a big difference for the things that people were having issues with. So I came in and we created a new app called Calm Health that we started building about 3.5 years ago. And what Calm Health is everything that is calm, plus many of the things that are associated with being able to take care of somebody's mental health in a more clinical way. Meaning, if you think about when do you know a person coming in for their mental health, how do you know they're doing? Well, basic assessments. So the PHQ for depression, the GAD for anxiety. People coming into Calm Health as a separate app, they essentially get those measures and we're able to triage them to clinical programs, which are written by clinical psychologists, experts, and they essentially are delivered by the voices of Calm, the narrator. So the reason we do that is because clinical programs, when it comes to mental health, need to be written by experts to make sure they're safe and effective. The problem with experts is that they don't know how to act. They don't know how to narrate. And there is a big problem with that in today's day and age because we have a bias, whether we're aware of it or not, that when we see content, it has to be engaging in about 1.7 seconds. And if it's not, people are going to ditch out. So we have narrators like Matthew McConaughey who says, whatever he says just sounds beautiful. And it brings in the person, and then we're able to help them with clinical programming. So being able to understand that the world of engagement is not an option in order to help people with their mental health is something that we believe very firmly in, and so far so good.
So not everyone can have Matthew McConaughey doing their narration, but let's go back to the premise of this conversation. And why do you think employee engagement in these tools is so low?
So I think a lot of why it's low is pretty obvious. It's because people don't recognize it. People are making quick decisions. They can't find it. And there's also a stigma, right? We talk about mental health and we talk about stigma. And yes, the pandemic pushed things forward so that there's less stigma. But in generations like my own, the Gen Xers, especially for the males, it's still there. Right? Still there. So we're underrepresented in therapy. And being able to have somebody go into therapy is a big step for the most part. Now, granted, like 20-year-olds, they're like proud of going into therapy. That's fantastic. So you have to be able to cater to the demographic. And when you're thinking about a population, you can't just say we have one solution with one brand and it's going to work for everybody. That does not work. We need to have multiple access points into the world of mental health in order to really help the whole population. And I always think of like why everybody was asking Calm to make more mental health programming. It's because we went in via sleep, right? So we didn't even know it, meaning I wasn't with Calm back then, but essentially all these sleep stories led to people going, I think I have something going on that's leading me to not be able to sleep, which is what the data clearly shows, that if a person is having trouble sleeping, odds are it's a mental health issue that's driving the lack of sleep. And being able to address that in a way that lowers the stigma, meaning a person says, hey, I can't sleep. No one in this room is going to be like, oh, they shared too much, right? Well, the stigma is low. So being able to come into a platform with free, no shame involved is one of the keys to being able to be successful in the world of mental health and digital tools.
So it's getting them through the door, and and at Calm, that was through sleep. Because as you said, there's some stigma to mental health, and particularly with different generations and different demographics, but people can say, I have trouble sleeping. That's, as you said, not oversharing. So how do you manage reaching these different demographics and in terms of their different needs and also their feelings about seeking help for mental health?
So being able to reach demographics means being able to reach the folks who aren't getting enough help. Meaning we know, and there's actually a great article in JAMA just a few months ago that shows that like therapy has increased because of digital tools. And that's great, so we thought, but what JAMA pointed out was therapy has increased with virtual tools in the people who are already getting therapy, not necessarily the underserved populations. So the people who were wealthier and in a demographic that essentially was already getting therapy, now they have greater access and are taking even more therapy. Okay, that's not a bad thing, but what we've shown is that children and underrepresented populations are getting less therapy. So there's a divide that's growing, that's going unaddressed right now. So being able to lean in to not where the traditional models of payment are for therapy, meaning if you're a therapist in today's day and age, you are incentivized to be able to see as many patients as you possibly can who have good insurance or are cash paying. And that's the way it is. So what ends up happening is the underserved populations keep on getting underserved. The problem with that is that health plans, essentially, or large employers, are in a stuck position because they have lots of people who don't fall into that demographic of wealthy and can afford and good insurance. So how do you help those folks who are dealing with mental health issues and are underrepresented in terms of treatment? Well, you create programs. You find experts who essentially understand that population. So I think of one example would be the African American population around hypertension. So at Calm Health, we have programs that are essentially around physical health conditions or lifestyle. So like a physical health condition would be something like diabetes or cancer or hypertension. And we find subject matter experts who are psychologists who specialize in that. They've written the papers, they've seen thousands of patients, and they know that population like the back of their hand. So when they write a program, we know that, yep, they know all of the research really well, super well. What we also know is that they're going to be able to speak in a way that resonates with that underserved population. Because if you think about, everybody in this room probably has seen a hypertension program and probably has, I don't want to be disparaging, but they're pretty much the same thing that's been going on for 30 years, 40 years with digital hypertension programs. And they don't resonate with most people. Take your meds and don't eat salt, exercise, right? That's not going to resonate with a population unless you're speaking about the direct issues they're talking about. So, and another one is like nurses. Nurses are a great example. If you sit there and tell a nurse who is dealing with anxiety to go take a 30-minute walk in the middle of their shift, you're going to lose that person in the middle of the session. So you have to really know the population well, and you have to go after the populations who aren't getting the help. And that's what we're doing. So we just create programs based on where the people aren't getting enough help, and we go there, and it's helping a lot of folks to be heard for the first time when it comes to their mental health and physical health.
And how are you communicating the benefits of these mental health tools without being overly prescriptive?
So communicating the benefits, it's an art. So words really matter. So everybody in this room has a way they like to be spoken to, and it's different. So being able to have your messaging be global and apply to everybody, it doesn't work. So you have to be very nuanced in how you target communications for folks. And when we talk about Calm Health, we're talking about a healthcare platform, right? So everybody in this room, for the most part, has an EMR, like MyChart connection point, because Epic is the biggest EMR. Healthcare compliance, like you could feel it when it's in play. And the communications are limited by keeping the data protected, by keeping the messaging in a way that is not soliciting you as a human being. You have to balance that messaging with being personalized and engaging for folks. Super hard to do, but being able to finely tune your message based on demographics without overreaching, meaning the phrase we use is essentially cool but not creepy. being able to help people say, oh, that was cool that they noticed that I have hypertension and I'm Black, so they recommended this program. That's really cool. What is harder is getting them into the platform and being able to write email communications. And a lot of times what happens with benefits is that there's limitations of how you could reach out to the employees. And being able to collaborate with the vendors is essential if you want to reach them, because we don't trust our health plans as a society, and many of us don't trust our employer around giving us mental health benefits. So what ends up happening is you shoot yourself in the foot if you say, we want to control the messaging 100% because we want to be able to say what we want to say, because there's lots of, we've done all the legal work, this is what we're allowed to do, and I totally get that and respect that. But at the same time, if you want to change something around mental health benefits, you can't take the traditional routes of delivering mental health benefits like you do a gym membership. It doesn't work.
So walking all these fine lines, this cool but not creepy, how do you get the employee to not only try it, but also stick with it? And as you said, the messaging with the company, it sounds like a hard conversation to have with the company of saying, yeah, your employees don't trust you guys. So how do you walk this walk?
So the way we walk the walk is people are coming to us because they love the brand and we want to lean on the brand, but we don't want to over lean on the brand and say, and overpromise that the brand is going to pull everybody in. So we don't want to say Calm is so great that you're going to get 90% engagement and everybody's going to pull through and we'll be able to just fill up your ecosystem and all your benefits. That's just not the way it works, because you're going to be different populations, right? If you have some Gen Xers, right, that's not going to be as great as some other demographics for pulling through a mental health benefit. So being able to have good conversations is essential, but I think it's also understanding that people don't want to get smacked in the face with mental health benefits. So that's, I think, the most important message, is being able to say, okay, when it comes to mental health benefits, the side door is going to be for 30% of your population talking about sleep. That's probably going to be the best campaign you go with. For this population, we're going to say, like, physical health conditions, because physical health conditions are another side door a person can come through and then get access. So it's being able to understand your population and then cater the messaging towards what they're dealing with versus just, again, a generic blast.
But as you said in the very beginning, there are a lot of apps and podcasts and movies fighting for our attention. What is going to get us, what's going to grab us? Yeah,
so there are a lot of podcasts and there's a lot of content. And what's going to grab us is the people who invest in being able to create the content that grabs us. And I think I said it in the beginning and I'll say it again. If you're not able to create the content, and I understand it's a big investment to create the content for any vendor to be able to do that, get it. The problem is, if you're not willing to create the content, people aren't going to engage. People are used and have an expectation on their phone. And you can say, like, I love being in Boston. I lived here for years, and it's like what gets pounded into your head in graduate school, like if in the science world, mental health world, is science will rule if you just are really super correct. If you just really have the best papers and you have the best references and you sound so eloquent, people are gonna like go, yeah, I believe them. It's not true, right? You don't get that kind of audience. It's not even close. So unfortunately, what wins is the engagement factor. So I think of podcasts and how people are getting so much of their healthcare information, especially mental health. It has nothing to do with a scientist. It has people to do with, not disparaging, people who are quasi-scientists, scientists in different areas, taking liberties, MMA hosts, like all these things, like, are what pulls people attention in. Right? So, like, I'll just say, like, Joe Rogan's a great example of why does he have so many followers? It's because he's super engaging, right? So being able to lean on that engagement factor as one of your partners if you can't do it yourself, because that is essential. You're not going to get people sitting there going, I'm going to invest 4 minutes until you get to the point in a piece of content. It doesn't happen for 99% of the population.
It's got to grab you. So what innovations and trends are you seeing in digital health that will have the biggest impact? What are you seeing out there?
So I'd say interoperability. So about 5 years in mental health, what ended up was like the answer was we're going to create solutions that are just like one-stop shops. If your employee has a mental health need, they're going to come into our platform and they can get anything from self-serve to coaching to therapy to meds, and that is not how it works. Meaning you're never going to get a whole entire population who just goes, oh, I'm walking into that one platform. So what we've seen is the point solution that's comprehensive in mental health, right? There's just a few survivors at this point who are doing great work. But what they've learned is that they need to be interoperable with their other folks. Meaning if you're going to one of the telehealth companies and you're working on mental health in that company, you want those notes to be able to be transferred over to the physical health components of their life. And unfortunately, that in the venture capital world, it's hard to convince many of the investors that we want to invest in interoperability, that we want to be able to create things that we can send to other platforms, that we want to send patients off our platform to another platform, right? That's the right thing to do. No doubt about it. For instance, like in Calm Health, if a person is dealing with moderate to severe issues, we're provider agnostic. We were like, who do you want us to send this person to? Because they're not appropriate for a digital health platform. Easier said than done for most platforms to send somebody off their platform onto another platform. But that's what we invested in, so we're able to do the right form of care by working with other companies. So people ask, like, who's your competitor? We don't have a competitor at this point because we're essentially just feeding patients to other providers based on what the employer or health plan wants.
So you didn't mention AI, and I'm
Yeah.
curious to hear your take on where we are with the technology and whether you are hopeful that it can increase personalization.
So there's no doubt. I mean, everybody in this room has used ChatGPT. That, it's pretty amazing. And we're at the point where AI is something that we're very invested in, and it's super easy to say the generic stuff around AI that, oh, soon to come, we're going to do great things. In 6 months, everybody's going to change around mental health because of AI. And maybe we will, maybe we won't. But I think what's really becoming very important around AI is where we are, is ensuring that when we think about AI and our AI solutions, we're working in closed loop systems versus open loop systems. So I think of open loop systems like ChatGPT, like, okay, it's using lots of stuff out there from all over the place and nobody knows because it's the wild, wild west. Closed loop systems are just like it sounds. Essentially, the data that you're using to create the algorithms that define AI and how you're delivering treatment are in an ecosystem that is essentially assessed by clinicians and in a way that is not going to cause harm. So you have to ensure it before you can deliver it. So we're looking at closed loop systems versus open systems going forward.
So as we wrap up, what is your advice to HR leaders and benefits providers in terms of how they should be thinking about mental health benefits, particularly if they are hearing from their employees, hey, we need this?
Mm-hmm. So I'd say one solution does not fit all. There is no message that I can say clearly enough other than vendors need to work with each other around mental health. People are coming in from multiple venues, and being able to connect the dots is pretty much the only way that you're going to get comprehensive care for an entire population. It's being able to have lots of different services, lots of different self-serve, actual inpatient unit connected to offboarding. Like, these are the things that we're building, not just a Calm Health, but all of the folks in mental health in the digital world who are essentially going, this is the right way to treat people, right? It's working within an ecosystem, just like physical medicine does. Meaning physical medicine is super great around being able to work at this point in an integrated way, right? If you have a problem with your knee, you don't go to your dermatologist, you go to the orthopedist, and your PCP works with your orthopedist to make that happen. That's what we need to have happen in mental health. And the digital world, because it's leaned in so far, people have leaned far to the digital application of mental health. That means the digital providers need to work together. And I think that's the take-home message, is that look for solutions that are playing well with others and working and investing in doing well with others, physical institutions as well as digital places.
It's that interoperability that you said.
It is, yeah.
Excellent. Well, Chris, this has been a really fascinating conversation. Thank you so much for your time.
Thanks. Great job, Rebecca. Thank you.
Thank you. Yeah.
Yeah.